So stage 4 power cuts are going to continue until Saturday morning. And while we come to terms with the reality that these scheduled cuts will be with us for some time to come, the debate around excluding hospitals from the blackouts is coming to a head. Tomorrow, the Health Minister is due to address this concern directly. But some welcome news already this evening from City Power here in Johannesburg. They have already moved forward to exclude certain hospitals and clinics. I'm joined now by Isaac Mangena of City Power. Isaac, this is welcome news. Talk to me about the 4 facilities you've already started excluding.
So we have received these requests from the Department of Health to consider excluding some of their facilities, the hospitals and clinics, from load shedding because of the pressures that they are going through and also because of the lives that they really need to save in there. So it's not actually 4, Sally, it's actually 10 of them that we have already started excluding. The whole city of Johannesburg, we've got about 137 health facilities that they had put forward as, you know, for us to basically consider whether to exclude them or not. So we can't do all 137 of them. So we have started with 10, at least major hospitals like Baragwanath, Helen Joseph's, Rahima Musa are part of those that we are currently excluding. We've already started from over the weekend to basically ensure that they've got electricity when the lights go off.
Okay, so because the original release we saw just mentioned 4, Parkhurst Clinic, Joburg Eye Hospital, Coronation Hospital. Is that Rahima Musa?
That's Rahima Musa.
Yeah, that's the same one. And Helen Joseph. It didn't mention Baragwanath. So you're saying that Chris Hani Baragwanath currently is ring-fenced, excluded from load shedding? It's
excluded from load shedding, but unfortunately there are cable thefts that happen around it that we cannot help. But in terms of scheduled load shedding, we have actually excluded them from that. They've got lights when the whole area is off.
That is amazing. What about Charlotte Maxeke?
Charlotte Maxeke is also part of those, okay. But we also have problems in terms of Charlotte Maxeke, even Rahima Musa itself, but that we have actually started resolving it, which is because of the network is actually embedded. These hospitals are embedded inside the network. We're not able to basically isolate them from the rest of the community around them. So, like for example, if you look at Coronation Hospital has got the whole West Dean connected with it on the network. They've got about 34 MVA that they are on that network. So for us to basically exclude Coronation, we need to exclude the whole of West Dean, which is not going to help Eskom with the capacity that they're looking for. So what we're trying to do basically now is to manually, which is dangerous, to switch it on and off manually, have operators going there every time. That is also part of overtime that we
overtime costs. So you're going to be doing that for Rahima Musa Hospital three times a day at the moment?
3 times a day. We'll need to basically send out the teams of operators to go switch on and off while we basically work around the network to ensure that we exclude Rahima Musa Coronation Hospital from the whole of the community. Otherwise, we are not going to be able to meet the threshold that Eskom is actually
I was going to say, because you still have to trim the load somewhere.
Yes.
So if the hospitals are going to be excluded, does that mean the rest of us in the city of Johannesburg might have to deal with an extra bit of load shedding?
Probably, but that's why we don't want that kind of a situation. So what we're doing now, so from the 137, we've got only 10. So we're also working around other facilities to see how many more we can actually exclude, and that work will basically involve us basically going into the configurations of our network and ensure that we basically manage to exclude some of those so that we don't find ourselves in a situation where people are dying. Remember, this is about saving lives.
If
we don't form part of that effort of saving lives, then it's going to be a doom nation. So what we're doing is basically to look at the network and see where we can be able to basically configure and see that we exclude some of those facilities.
All right. So just to talk to me about Charlotte Maxeke. You did start talking about, is that going to be excluded as well?
Yeah, Charlotte Maxeke is excluded. Helen Joseph is also excluded. Baragwanath is excluded, and some of those that have already mentioned in the statement.
All right. So what about private hospitals? Does this include private hospitals as well, or is this only about government hospitals where you're trying to protect them?
In the list of the 10, we do have private hospitals. We do have net cares included in the 137, and even in that 10 of those that we're excluding currently, we do have those. But remember, in terms of of the law, in terms of NERSA regulations, the health facilities, hospitals and clinics, the onus is on them to basically have internal capacity for when there are no lights.
Even and we know they do, but,
yeah.
But the problem is a lot of these hospitals are old and the backup is only meant to be in an emergency every now and then. Yeah. It was never designed, and I mean, this is a problem you sat here and told me about with your infrastructure, City Power.
Yes.
It is not designed to run for hours at a time.
Indeed.
The backup generators.
Indeed.
It puts a strain on the system.
Indeed, and we really do understand that.
Yeah.
We have meetings with most of these because remember they are part of our large power users. These are the people that we have meetings with them almost monthly or weekly to just make sure that their needs are met. So some of the issues that we talk about is basically this investment in generators. Running generators is also expensive, and that's the money that government does not have to basically ensure that these hospitals run on them. So if we can be able to exclude them, let's do that.
So there's 137 hospitals and clinics in Johannesburg, and that's public and private. Are you aiming to be able to exclude all of them from load shedding?
It probably will be a long shot, for now. But I think we are working with them to also look at the alternatives. To say we're talking of IPPs currently. We're also, as the City of Johannesburg, looking at starting this rooftop PV systems across our buildings. So it will obviously be rolled over even to the government institutions like hospitals, even schools themselves, so that at least they have some of that, which is not basically affecting electricity or whether to switch on and off. So when Eskom is having its problems, we also want to ensure that we've got our health facilities and even other essential services like water running while we are dealing with the issues of load shedding.
And as you say, this is also at the request of the health minister, and we know that tomorrow he's going to be speaking on a national level. Yes. So let's hope we see this happen in other cities and towns around South Africa, because it could have a disastrous impact if any of that backup power doesn't work. Thank you so much. I know that you must be very, very busy, bearing in mind all the systems that fall apart whenever load shedding comes back on and off. So thank you for coming in. How is it going, by the way? Is it still very, very busy?
It is. The system is really taking too much strain because of this load shedding. As I'm talking to you now, the residents of Windsor, Cresta, parts of Randburg do not have electricity, and they won't have it until tomorrow morning because of, during load shedding early this morning, thieves came in and they stole copper cables that are on Eskom transformers, and so we're currently busy working on replacing those. So we're looking at the ETR around 2 or so in the morning. So those people don't have electricity. So over and above the theft that is increasing during load shedding, we also have breakdowns, electrical breakdowns, equipment failure, and so forth. So it's really taking a serious toll on the wear and tear of our infrastructure.
Oh, well, good luck. Keep at it, and I hope you get some sleep this weekend. Thank you so much. Isaac Mangena.